In this section, you will learn how to deliver oxygen with a concentrator. Pediatric Home Service offers a variety of concentrators. Your pediatric home service clinician will determine what concentrator your child will use after reviewing your doctor's orders, your child's activity level, and home setup. Let's get familiar with how a concentrator works by reviewing the basics. Concentrators run on electricity. You will also have backup oxygen tanks for portability or as backup if your home loses power or the concentrator is not working as it should. Make sure to review the section Tanks. To ensure proper function, the concentrator needs to be positioned at least 6 inches away from walls, furniture, and drapes. Before setting up a concentrator or changing out oxygen tubing, always remember to wash your hands. Here are the steps needed to set up a concentrator. First, plug the AC cord into a properly grounded outlet. Then, push the power switch to on. In most cases, an alarm will sound at startup. If you do not hear this alarm, call Pediatric Home Service. Finally, use the control knob or button to adjust the flow of oxygen as ordered by your doctor. If you feel the concentrator is not meeting your child's oxygen needs, call your Pediatric Home Service clinician. Don't try to set an oxygen flow at 0 or above its highest setting. Doing so may damage the concentrator and cause it to sound an alarm. Each week, the concentrator needs to be cleaned and checked. This will help lower the risk of contributing to infection and ensure the concentrator is working as it should. To clean, first wipe down the outside with a clean, damp cloth. Then check, clean, and change out the filters as instructed by your Pediatric Home Service clinician. Finally, check the oxygen tubing and replace it if needed. Used tubing can be discarded. All concentrators use lights and alarms to help you know when they are working and when to troubleshoot. When a concentrator alarms, put your child on their backup oxygen before trying to troubleshoot. Then, check to make sure the power cord is plugged into a working outlet. Check the air intake area to make sure it's not blocked and that the filters are clean and placed properly. Check to make sure the flow control is not set at 0 or above the highest setting. Check to make sure the oxygen tubing is not kinked or blocked. If none of these correct the problem, look in the operation manual for more troubleshooting help. If all else fails, 1. Turn the concentrator off. 2. Wait 10 minutes for it to cool down. 3. Turn the concentrator back on. If the concentrator is still not working, call Pediatric Home Service for help. Once the concentrator is working as it should, you can attach a nasal cannula, simple mask, extension tubing, or inline adapter. Go to the section Oxygen Connections to learn more.